Tacoma-Pierce County and the program manager of Tacoma-Pierce County Home Department's Parent, Child, and Family Health Programs. We are gathered today at the Environmental Services Building above the beautiful inland waters of the Salish Sea. Since time immemorial, this land has been cared for by the Puyallup peoples. Their stories, languages, and rights have been systematically erased over centuries of colonization and dehumanization. Last Monday marked Indigenous Peoples Day. And speaking only for myself here, I stand with Indigenous peoples everywhere from Turtle Island to Palestine in their struggles for survival, sovereignty, and liberation. We thank the Puyallup Tribal Health Authority, the tribal nation, for putting together this video.
Arti swatput a tish boyalapaj, a slot hill, alti disha to alturi tuha.
It is the land right here that the Puyallup people have lived on since the beginning. This right here is where we are in the world, our homelands. Uyayus chash alti swatufted a tishu ishichash. Ukacha chash tish badadat chash. Uoch twati chalop alti swatufted a tis boyalapaj.
We work on our ancestral lands. We raise our children who go to school on the land of the Puyallup people.
We acknowledge that the Medicine Creek Treaty was signed for the whites to take our land for their benefit.
Land was assigned to our people. The Caucasians said, "This is your land," and they took that land from us too.
Our land was stolen from us. Treaties were broken.
But we are still here today.
Our people forage for food and materials, we pick berries, we canoe, we practice our traditional ways, and we speak Twoshuti.
Just as our ancestors did.
We are finished.
All right, just a little bit of, housekeeping. So the restrooms are just outside this room across the lobby. There's, just to the left of the restrooms, if you're looking at them, there's a room that is, has black curtains all around it. That's a lactation room. Also, maybe if you need a quiet room, it's got a plug, and feel free to use that space as you need to. On the side of the room here, we have coffee and tea, and at the back of the room, we have cookies. Please feel free to just help yourself, get up, and take care of yourselves as the day progresses. And we're gonna have a large, significant break in the middle of this day. This day is really about getting to connect with one another, and so there will be snacks later. So the Perinatal Collaborative of Pierce County aims to improve the health of Pierce County infants and the people who care for them. We do this by providing opportunities to learn best practices, by promoting networking among providers to increase coordination of services. And we really hope to accomplish both of these goals today. When we were here last year, we talked about mitigating maternal mortality, preventing further deaths of birthing people. Today, we're going to build on that conversation. Our theme is nurturing parents, bridging gaps. Why? Our parents aren't okay. I'm going to hold this. Is this better? It's not on. Very sorry. Ooh, hello. Party. Okay, I'm sorry. I'm not going to repeat what I said, but I'm grateful for you. So our theme today is nurturing parents, bridging gaps. Why our parents aren't okay. 1 month ago, Surgeon General Vivek Murthy issued an advisory on parents' mental health and well-being. He described how the unique challenges of parenting today are a serious public health concern. The report stated that 41% of parents report that on most days they are so stressed they cannot function. 65% of parents report that they are lonely, 75% if they are single parents. There is mounting evidence demonstrating that postpartum depression impacts all parents, regardless of if they gestated. So why is parenting uniquely more challenging today? Well, we're dealing with a whole new set of challenges. We're managing social media, a mental health crisis, an epidemic of loneliness, gun violence, and a culture of comparison intensified by social media that makes us all feel like we're not good enough. Let's place these contemporary stressors within the context of a widening racial wealth gap, ongoing oppression of indigenous peoples, people of color, and poor people, economic pressures that make it impossible to own a home on a two-parent income, let alone a one, the residual effects of the pandemic, and a lack of a social safety net. It's a lot to bear. And as we discussed last year, when stress is prolonged, it has health-damaging impacts. That stress percolates in our bodies and impacts our children, and their children, and their children. So today, we're going to dig into what we know about parents in Pierce County, their stress and their health. And we're also going to talk about what we as providers can do to protect parents. And then we're going to relish in the incredible work of some of our colleagues and celebrate how they're uplifting parents and children in our backyard. We'll start with a presentation by Dr. Ingrid Freiberg. She is an epidemiologist at the health department and will review local, state, and national data, and will learn about factors contributing to access to care, mental health, and infant feeding, and explore potential opportunities for the future. She'll be followed by a presentation by Dr. Miriam Savadi at the Puyallup Tribal Health Authority on the influence of oppression on patients and health outcomes. She will dig into how systemic oppression, including racism and sexism, contributes to adverse prenatal outcomes. Dr. Savadi will share strategies for delivering anti-oppressive evidence-based care. After a significant break, where we'll have snacks and connect with one another, we're going to close the afternoon with an incredible panel of local champions of maternal and infant health. These 4 leaders will share how their strategies for navigating challenges and expanding community supports for families in Pierce County. So one piece of feedback we received last year was that there's a desire for more opportunities to connect with who's in the room and learn from each other. So in addition to the large networking break I've mentioned, and snacks, interspersed into this day will be opportunities for you to connect with who you're sitting with. So after each presentation, we are going to ask questions of you to explore and share your strategies and your challenges. We also have a lot of raffle prizes throughout the day that will be interspersed through until the end. So we hope that you'll stay with us until 5. And before we meet who you're going to be sitting with, I want to share my heartfelt thanks to the board of the Perinatal Collaborative, especially Kendra Alman and Karen Hurdy, who without their champion level work today would not have happened. I want to thank the presenters and the panelists for sharing your wisdom with us today, and thanks to you all for joining us. It's a privilege to get to be in this work with you, and I'm excited to dig into what it looks like to bridge gaps, what we're doing, what we're still learning to do, what we still have to do ahead of us. Okay. We're going to take 15 minutes and get to know the people at your table. Please take 2 minutes each to share who you are, your pronouns, what you do to champion parents in Pierce County, and then share what brings you here today and what brings you joy in the work that you do.